can honestly say I would have never predicted that I would actually be talking about Ebola virus ever. Would not say I'm an expert in the sense that I've never taken care of anyone with Ebola or seen a case of Ebola. Probably never will, but I do know a thing or two about infectious disease and communicable disease, the study of epidemiology, which is the study of disease processes, how diseases go from person to person, where they are in the environment, how they affect humans, what factors will make someone more likely or less likely to get a disease. That's the study of epidemiology, and you can, it's a very wide encompassing field. There's the epidemiology of communicable diseases, but also chronic diseases, things like that, and all sorts of different health factors, car accidents, you name it. So what we're going to talk about a little bit, I want to just get into a little bit about what the disease is. So I'm not sure some of you probably know far more about Ebola than you ever thought you would. Reading the scientific literature just like me, the New York Times and things like that, which is where you get all the information. I'm not sure exactly what people want to know, but I guess, are people concerned about Ebola disease? Raise your hand. Are you worried about it? Are you worried about it personally? Is anyone here worried about getting Ebola? No, that's good. You passed. Okay. I guess some people are. Are you worried about it spreading in the community? No? Maybe a little bit? Okay. I guess I think we probably feel a little sheltered here because of where we are. We're a little bit sheltered from some of these going on. New York City seems far away, and certainly so does Texas and other places. So we probably have different perspectives on that risk than people who might live in areas where there is a lot more travel. Certainly we live in a smaller world these days. With global travel, people can go from Africa to Petoskey in a day. 3 flights, boom, you're there. So it's not unheard of. Things happen, people travel. We'll talk about that a little bit. So we're not completely isolated here, even though sometimes it feels like it, especially this time of year. So what is Ebola? I bet everyone's seen this picture, right? Yeah, that's the CDC. It's like such a cute little thing. It's that crookshank or whatever, shepherd's crook, right? The little staff. And that's an electron micrograph of the Ebola virus. And for some reason, it likes to take that shape. So that's now become kind of the selfie of the Ebola virus, I guess. So what it is that's a single strand of RNA. There's DNA and RNA. This is an RNA virus from the family Filoviridae. There's a couple main viruses in that family, Ebola and Marburg. And they're kind of grouped together, or they used to be when I took my coursework. It's a viral hemorrhagic fevers, and there's different viruses that can do it. Marburg and Ebola are similar viruses that can cause a similar illness. They both tend to be located in different parts of Africa. There's at least 3 different subtypes of Ebola virus. So what is it? I said VHF. What that stands for is viral hemorrhagic fever, because that's really what it's known for. It's a virus that causes hemorrhagic bleeding, fever, and fever. It's a very severe disease, often fatal, caused by an infection from a type of Ebola virus. It was first discovered, I'm sure it was around before then, but first discovered in 1976. And it was, I think it was actually Zaire, it used to be Zaire, but now it's the Democratic Republic of the Congo. And it was near the Ebola River, and so they named it after the river that was where it went through. Since then, outbreaks have occurred sporadically. They've had outbreaks in other parts, mostly in Central Africa. This is by far the largest outbreak of Ebola in recorded history. The other outbreaks were more in the hundreds of people, not in the thousands. Were a lot easier to control. They tended to be in smaller villages, more remote areas that were easier to kind of cordon off and stop the transmission of the disease. So this is where a lot of the outbreaks have occurred. This is more Central Africa. so people who know the geography. Over here is where we're talking about West Africa. We have Sierra Leone and Liberia and Guinea. And that's where the current outbreak is occurring. So when you hear about people worry about people in Africa, I think we all know that is a big continent, right? So here's where you have transmission of Ebola right now. You don't in these countries currently. They have in the past. So we have to worry, maybe you have to worry about someone who's traveling from these countries, but you don't have to worry about people traveling in the whole rest of the continent. And I say that because when this first came out, I had a doctor's office who refused to see a patient because she had just finished her missionary trip from Uganda. Does anyone know where Uganda is on that map? Not the greatest map, but I think it's like right in here, right? You know, Harry knows her African continent. So that, Uganda, that would be like saying, you know, I'm not going to let you come into I'm not going to let you see in the office because there was an Ebola case in Dallas. You say, I've never been to Texas. I say, well, you're in the U.S. I mean, we're closer to Dallas than Uganda is to these people here. So you can't worry about Africa travel. It's really much more specific, and those are pretty small countries geographically. What's the epidemiology of it? So how do you get this disease? It's a virus. We think it first comes from, we're not sure exactly where the reservoir is. Where does this virus live in the environment when there's no humans with it? It lives somewhere in the environment outside these villages. We think it is primarily the reservoirs of bats and primates, but we don't know this for sure. There's pretty good evidence to suggest some of the fruit bats, as well as perhaps some other primates, may be reservoirs. How do humans get it? They come into contact with these animals. It may be from coming in contact with the droppings. It may be from eating bushmeat. They'll eat bats. Bats are mammals. So if they're killing that animal, processing it, they're touching a dead animal that's infectious. That's how they can get it. Once a human has the disease, then it can be transmitted to other humans. But the transmission is through direct contact with bodily fluid. This is not something you get in the air. It doesn't travel through the air. It's not really spread by people coughing, mostly because people don't really get a lot of cough with this illness. It's not a cough illness. So it's really through direct contact with someone who's infectious. And it can't be someone, it's not just, once you get infected, if you get infected with Ebola, it takes several days for you to get sick with it. That's the incubation period. It's 2 to 21 days, usually 8 to 10 days. While it's incubating inside you, you aren't spreading it. It's not in high enough numbers. It's not in your bodily fluids. It's not in your saliva. You can't give it to other people. Once you're sick, viral loads go up, then you can spread it to other people. But they need that close contact. It's not easy to get like some other viral diseases like the flu or measles or chickenpox. Funeral exposure seems to be a very high risk in Africa because of how they handle the bodies, and corpses can have very high, they can still be very infectious during these times where they're having their funeral rites, and there's, I guess, a lot of touching that goes on during these funeral ceremonies, and they think actually one of the ways this current outbreak really spread, one of the initial cases was a village healer who, at his funeral, hundreds of people went to his funeral. He had died of Ebola. They all touched and get very close to the body, and that's where then that kind of spread from there. It doesn't. People ask me this. Well, how long does it hang out in the environment? You know, if someone was sick with Ebola, how long is it sitting on the desk or the chair or the subway? People were worried about the subway, right? Not very long. In good conditions, if it's dried, probably not more than 24 hours. Depends on temperature and humidity. I'd say in our favor, I don't think Ebola likes our weather. I would pretty much bet it doesn't like the cold. And it's not going to hang out too long in our environment, that's for sure. Questions? If you do, you can pop them up. We're just going to roll through these. So what are the initial symptoms of Ebola? I think we've already heard this. Fever is the big one. Most everybody starts getting fever initially. And then it's really kind of non-specific. These are pretty typical symptoms, right? Flu-like symptoms. You have a fever, you're feeling bad, you're achy, maybe muscle aches, headache. You just like you're coming down with something. It could be the flu, it could be malaria, it could be Ebola, it could be lots of different things. 2/3 of them pretty quickly then start developing some kind of stomach symptoms, vomiting, diarrhea. Generally, you don't have cough or respiratory symptoms with it. So that's going to differentiate it from the flu and all sorts of other respiratory illnesses that we see much more commonly here. What happens over time is after a few days of those initial symptoms, it can progress to more severe symptoms. And the severe symptoms typically are watery diarrhea, nausea, vomiting, abdominal pain. This is in all of the literature, hiccups. I don't know why, but they develop hiccups, yeah. I don't know through some sort of mechanism. And then the reason why people die from this is they get multi-organ dysfunction and shock. The bleeding, the hemorrhagic part of the disease is generally what that is from. Is this virus causes it causes the insides of your blood vessels to get inflamed. And the endothelium, the lining in your blood vessels, gets inflamed, and it starts the whole clotting cascade through this whole mechanism that then ends up consuming some of your clotting chemicals in your bloodstream that help you clot, and you just start bleeding and oozing. You're not gushing blood, but what they do is they can start getting little bleeding under the skin. That's a rash, that little petechial rash. Ecchymosis, bruising. They start showing bruises. They'll get nosebleeds, bleeding from their gums. They can have bleeding in their intestines that can come out on both sides there. And along with that, it's also going on inside their organs, and they can have liver failure and all sorts of other multi-organ failure that puts them into shock. They can have massive fluid losses through the diarrhea, so that if you can't keep up with them with IV fluids or other ways of keeping them hydrated, they go into dehydration shock. And if they're going to die, it's usually around 7.5 days after they have that initial onset of fever. If they don't die, they usually start getting better around day 6. That's real variable, and the case fatality rate is also really variable. You're seeing a lot of different things in the literature, but certainly as high as 71% is what they're reporting in West Africa, where they don't necessarily have access to real straight care. How do they diagnose it? There's a blood test, PCR, which is polymerase chain reaction. It's a specialized test that looks for the presence of that viral particle, the viral RNA, usually in your bloodstream, is how they test for it. And that's how they test for it here. If we thought someone had Ebola here in northern Michigan, we have a blood sample sent down to Lansing, and within a few hours they could give us the results. Lansing is the state laboratory. This isn't a test that your local hospital does. It's a very specialized test, and we have not had a need to do them, and I don't foresee us doing a whole lot. So what do you do for it? Well, mostly it's supportive care. And that's whether it's here or in Africa or wherever you are. Supportive care means maintaining your hydration status with IV fluids, maintaining your blood pressure with medications. There's no antibiotic that you can give or antiviral that will kill this virus or alter the course of the illness. There's been a lot of different talk about different experimental treatments. There's been, and the people hospitalized in this country have received several different types. They seem to work because the people, of course, survive. Does that mean that they have any bearing on the outcome? No, we don't know. You have to test a lot of people and figure out if it actually works or not. But there are several different experimental treatments out there. One of which is just taking someone who survived Ebola. Now they have antibodies to protect them against Ebola, and taking some of their blood, getting out the immune globulin, spinning it down, giving that serum to someone who's sick with it, and that will help, that immune globulin will help fight off their infection. Again, experimental, but that was in the news, and a few people got that. There are some vaccines in the works. Canada, for some reason, developed an Ebola vaccine. It's in phase 1 clinical trial. You're not going to see an Ebola vaccine anytime real soon. but there are several out there that are being developed and could possibly come to market. Of course, the companies like to have a market for something, so it requires some level of funding for that to be developed. So what's going on currently? Where are we with Ebola? Well, here's the 3 countries where there's ongoing outbreak. And the first number there, like for Guinea, 1760, that's the number of cases that have been reported. And then the second number is the number of deaths from Ebola. So in Guinea, 1,054 deaths out of 1,760 people. And this is updated every week. So I just took these numbers from the CDC, last updated on, I think, November 7th. So these numbers will go up as new cases come in. But Nigeria did have 20 cases, but that outbreak is over and there's no ongoing transmission there. So that's what's going on in Africa. Where those numbers will go, I don't know. The better we are at taking care of things in Africa, those numbers that are going up are going to start leveling off. And the hope is that we can end the outbreak there. But it's certainly not something that's going to happen overnight. It's going to take weeks, months to occur. Do you have a question? Well, yeah, here you've got, that's well over 50%. That's, and here is less, and this is much less. So maybe they're getting better care there. Absolutely could be. They might have better resources available to provide more care. The other thing that makes a big difference on whether you survive this illness or not is what your underlying health is. Someone who's already malnourished, maybe their immune system's already having trouble because of chronic infections that they're fighting, or protein malnutrition, or malaria, or other things going on. They're much more susceptible. They don't have the reserves to survive this. You take someone who's healthy and gets this illness, especially over the age of 5 and under the age of 40, you're much more likely to survive this illness. Mm-hmm. Mm-hmm. Well, the 2 people I know who got it, I guess, lived. So there you go. But would they have lived anyways? My bet, yes, because they were in America. They were getting, intensive care at some of our best hospitals. They were at early diagnosis. They were less likely to have severe complications of this illness anyway. Not that I don't know. Not that I know of. They have had some experimental treatment sent out there, but there's just not that much of it. What's going on currently? So here we are in the U.S. So there's thousands over there in Africa. We've had 4 cases now, 1 death. 2 were acquired locally. So we have the 2 nurses. Everyone heard that, I bet. The 2 nurses who took care of the guy in Dallas. Those were the 2 cases that were they caught Ebola in the United States. They were both nurses taking care of someone known to have Ebola, and that's it. That's where we are now. And then there were the 2, the one physician and the gentleman in Dallas who came back from Africa and then got sick with Ebola while they were here. We've also had people who had Ebola in Africa and then were flown here for treatment and taken care of. They've not transmitted it to anyone. So that's not a whole lot of disease. So we've got this nation that everyone's all kind of, scared and on edge, and the media is going crazy about it. And we have, that's it. That's what we got. Spain has had 1 case. That's it for Europe. Canada hasn't had any. So we're not seeing a whole lot. And we have more things in place now than we were initially here. Everybody who's coming in from an area where there is Ebola is being, when they come in at the airport, there's a quarantine station there. They're being screened, and those people then are being followed up regularly, and we'll talk about that more. But that really is going to should prevent, everyone who could possibly come down with Ebola. They're not going to just walk into a hospital and find out later that they had Ebola. We're gonna know about it. Could someone sneak in and people not tell the truth? Certainly they could, but I don't really think that's a real issue here. I'm not too worried about that.
I think the guy in Texas did it, but
well, he had been in the gentleman in Texas had been in Liberia,
okay,
and he returned here,
okay.
And the hospital just was not prepared for that. Should he have been screened? Should they have figured all that out? I mean, who knows? But that was a while ago.
Okay.
And at that point, they really weren't thinking about it.
That kind of answered my question, but what would be your hypothesis as to how that was spread from that man to the nurses? Was that just a protocol?
The nurses, clearly there was some exposure there that you would not like to see with healthcare workers. They were following the protocols at the time. I think it's a good lesson for us, and so that's really the real risk. From a community side, spread is really unlikely, and the reason is because it's not a very contagious illness. It's not contagious until they have fever, and even once you have fever, you're not that contagious until you really start getting sick with this. And there's actually a graph, and there's studies that have looked at this. And there's a lot we don't know about this disease, but the viral load, how much virus is in your bloodstream, and how much is in your bodily fluids, there's not that much, even when you first have a fever, those first days. But as you start getting sicker, the viral load goes up and up and up. And so by day 2 or 3 after that virus, and the people are sick, and they're dehydrated, and there's horrible vomiting and diarrhea, and this is unpleasant stuff here. Now they have a very high viral load, so they are contagious. But before that, they just aren't. You're not going to get it sharing a buck with this person. You're not going to get it very easily at all until they're really sick. And if you look at all of the cases, the 4 cases of people who came down with Ebola in this country, none of their household contacts got sick. We've had 0 transmission in the community. So the first case in Texas, he lived in a 2-bedroom apartment. He went to the hospital and was sent home and had to go back. So he was sick for 3 days in a 2-bedroom apartment with 5 other people. None of them got it. Nobody else is getting it once they get in the hospital, because that's here. Once they're sick, now they're contagious, and the risk is to the healthcare worker. Why is it more of a problem in Africa? Well, because a lot of these people are being taken care of at home. They have nowhere to go. And if they're at home and they're bedridden and they're really, really sick and they're dying of Ebola, they are contagious. So then it is going to spread. So that's why we don't see it spreading here. This is called R0. I wanted to teach everyone an epidemiologic term. Has anyone ever heard the term R0 besides Carol? Yeah. Oh, somebody has. Do you know what it is?
The number of people you're likely to infect?
Yep, exactly right. So there's R0 for all sorts of communicable diseases. For measles, anyone know what it is for measles? 15, 18 even. So really high. That's why we used to quarantine households way back when, before measles vaccine. Because if you had measles, if I had measles and I walked into this room, and none of you had ever had measles, and none of you had had the measles vaccine, 18 of you would probably end up getting it if you sat here long enough, because I'm talking at you and spreads through the air, and it's going to waft all the way to the back row and get you. The flu is like 4 to 5, so very contagious. So I'm going to give, if I had the flu right now, I'd give it to 4 or 5 of you if you didn't get your flu vaccine. So you should get your vaccine. The R0 for Ebola is, what is it? Nope. What's the R0? It is contagious, but how many people, if someone has Ebola in the community and no one around them is immune to it, how many people will get it? It's 2. That's at least what the epidemiologists tell us. That's what it is if you do nothing. That's not in this country, that's in Africa, it's 2. Which, if you do nothing, 2 gets 4, gets 8, get 16, 32, it gets big. And that's where those initial fears came from, that, you know, the World Health Organization was like, we could have, you know, tens of thousands of deaths from Ebola in Africa, because if you do nothing, the number is just going to keep doubling every 8 to 10 days. That's serious. On the other hand, the reason why, when this first came out back in August, the CDC was very smug, and it was probably not the best risk crisis communication, but they were very smug on TV and just said, well, we don't have to worry about Ebola. Nothing to worry about. And the newspaper ran with that when all of a sudden there was Ebola in our country. But the reason they were so smug was within our knot of two, and the fact that it's just not very contagious. They know we're just not, you're not going to see spread of this disease in the community. It is not going to spread through the community the way the flu does, or the way whooping cough does in Traverse City right now, or lots of other diseases. It's just not that kind of disease. And all we have to do is a little bit of public health work to isolate people who are sick so that they can't give it to other people, and watch their contacts and make sure they don't give it to other people, and you're not going to have it spread. It's real easy to make an R naught of 2 to be less than 1. If it's less than 1, the disease goes away. And really, it's easy to do in Africa if they have the resources. It's been done in the past. I think it will done here. It's just, they just need a lot more resources because the numbers are bigger, and these countries just don't have it. So that's our community-wide threat, really. It's just not a threat. What's really the risk? The only people that really have to worry about that in this country are these guys, the healthcare workers, healthcare personnel. They need to worry about it because if someone comes into their hospital and they're sick with Ebola, they can spread it to them. So if I'm a nurse at a hospital, I'm going to be a little more concerned about Ebola than other people. I think every hospital, including ours, needs to have some level of preparedness, and they are preparing. They don't necessarily have to be ready to treat people with Ebola, but they do need to be prepared to evaluate someone who might have Ebola. And why that is every day, you know, a couple hundred people come back from West Africa. Some of them are visitors, but most of them actually are residents of this country. So, you know, I certainly hope we would welcome them back. And a lot of them are volunteers who've been working out there. And we have a wonderful community here, and we have a lot of people who like to volunteer. So I have no doubt that over time, we will have people who were in one of those 3 countries who were volunteering, trying to help. Maybe they were taking care of Ebola patients. Maybe they were handing out food to the people who were taking care of Ebola patients. But they're going to have some risk of exposure, and they are going to come back home. And those are people that we're going to have to at least help monitor them for illness. And, you know, what happens if they get a fever? Well, they need to be evaluated, and the healthcare worker needs to be ready for it. So the hospital and EMS also, they need to think about their techniques. And it's really just a matter of preventing that direct contact with that person's fluid. So they have all these ways where, you know, they can gown and hood and have hoods on and masks on and gloves on, and all the things that they need to do so that they don't have direct contact with bodily fluid. And you can't get it won't get absorbed through your skin, but if it gets on your skin and you have any little cuts on your skin, then it can get in. Or if it obviously gets into your mouth or eyes or any mucous membranes, it can do that. And when I talk about bodily fluids, again, we're talking about blood, but also not, you know, emesis and stool and other things, not so much in the sweat or saliva, but you can have some there too. So the 2 nurses, there was some violation of that protocol. They had contact, clearly. I think that the reality is it's really easy to put this stuff on. It's hard to take it off without messing up. And there certainly could have been something there where that happened. We're human, so in the best of circumstances, you're going to have screw-ups. You're going to have mistakes are going to happen. Humans make mistakes. So what's our role? I work at the health department. So our role, you know, again, I'm not too worried about it in the community, but it is our role to make sure if there are people who are at risk, to identify them, because I don't want you know, I don't even want a little bit of spread in the community. I don't want any spread in the community because it has a high mortality rate. So we want to keep our community spread at 0. And really, I don't think it's that hard to do. So who's at risk? Right now, the only people at risk, really, as we don't have any cases going on in this country, are travelers, people coming back who've been exposed. So what's the risk categories? The CDC put this into different risk categories. High risk is someone who was taking care of an Ebola patient, someone who knew they had Ebola, and they had an exposure. They weren't wearing their mask and shields and everything, and they actually got splattered or they poked themselves with a dirty needle. They had an exposure. They're at high risk. Some risk would be someone just out there working because things to protect the health of the public. Those are pretty broad powers, and if you look up the laws, they're very generic. There's not anything too specific. It's basically whatever we need to do, we can do. Two things it does do is it allows us to ask people to stay in isolation. So you hear that term. So I wanted to just give you guys a little bit of public health education today. Isolation is for people who have disease, because these terms get misused all the time. So we isolate sick people who are communicable. So the people with Ebola get isolated in the hospital, and the one, like the physician in New York was just released today. They didn't let him go when he was feeling better. They let him go when he was feeling better, and he no longer had any Ebola circulating in his blood, and they felt that he was not communicable to the public. So that's isolation. We do this locally. We do this. The most common reason is tuberculosis. We do this. People who have active tuberculosis they represent a threat to people because tuberculosis is contagious. It spreads through the air. So people, if they have active TB, we make them either stay in a hospital room or stay at their home or somewhere else. They don't have a home, but we don't let them go out. I don't let them go to work. We don't let them take transportation. They're stuck there. Quarantine is used to limit the movement of people who are not sick, but they've been exposed and they might become communicable. You know where the term quarantine comes from? Anyone? In Latin, but the quarantine comes from the term 40, because it was 40 days, and it started in the 14th century. Ships would come in, I think, like to Venice, and the plague was circulating in Europe, the bubonic plague, and Black Death, people were dropping everywhere. So they somehow figured out that, or felt that if they made these ships sit in port at anchor for 40 days, then somehow that wouldn't bring the plague in. They didn't understand what was going on, but that's what they started quarantining ships coming in, and that was the first expression in where it came from. So we quarantined people. That was done a lot more in the 19th century before there was vaccines and antibiotics. But we still do have the power to quarantine people, and that's been talked about with Ebola. Other things we can do, other public health measures, I don't think we would ever use them in Ebola, but the health department also has the power, if there's an imminent danger to the public, to issue emergency orders which can control that epidemic. What might that be? That might be closed schools, because and during pandemics, a lot of schools closed. The Grand Traverse Academy was closed for the entire week because of a whooping cough outbreak. Truthfully, that was not on order of the health department. That was the school's choice to try to limit the spread of disease, but the health department was supportive of that. Other things we can do is we can ban social gatherings. Back in the pandemic flus in the 1920s, you can close movie theaters, you can cancel football games, you can cancel school, close public gathering places, basically tell people, stay home, don't go out, don't talk to each other, just use your smartphones. I guess they probably wouldn't even bother young people. I don't know, they wouldn't even notice. But it is like in Traverse City, they closed the school to prevent the spread of whooping cough, and now all these kids, well, they're off to daycare and the movies and the mall, so I don't know. So the letter that goes home is like, try to stay home, but parents have to work, and teenagers will be teenagers. So what can you guys do? It doesn't sound like anyone's too worried, which is good. You can stay informed. There's a lot of misinformation, and things also change really rapidly. So Michigan actually has a very good website, michigan.gov Ebola. They link you to a lot of the CDC guidelines, and there are handouts there for you name it. There's information for anybody and everybody there. How can you keep yourself healthy this year? Washing your hands is really good, especially before you put them in your mouth, like eating, covering your cough, staying home if you're sick so that you're not spreading it to other people. Getting your flu vaccine, I mentioned that, because every year anywhere between 5,000 and 50,000 Americans die from the flu. And so I am sure this year I can tell you that we will have thousands of Americans die from influenza. And we've had one die from Ebola, but there's a lot of people out there who are scared to death about Ebola but won't get flu shots, which could actually help prevent them from dying from the flu. So that is the